information, but we're connecting right now. Katelyn, you have a hard out at 5:30, correct?
I can go a little longer. This is
Okay.
more important, so I'm flexible.
Okay. We'll try to do it in about 20 minutes.
Okay.
And we've got people joining us right now. Hi, everyone. I'm not sure if you all were watching the news conference with President Trump and sort of all the health officials at the White House. And of course, I wanted to talk to now my friend, Dr. Katelyn Jetelina. Dr. Katelyn Jetelina is an epidemiologist, data scientist, scientific consultant by day. By night, she's the founder and writer of Your Local Epidemiologist. She started that in 2020 to help her students, faculty, and staff make sense of the constantly evolving public health landscape. She's got a master's in public health and a PhD in epidemiology and biostatistics, and her mission is to break down complex public health science into relatable, evidence-based insights so others can make informed decisions. Okay, Katelyn, I just watched this news conference, basically the gist of it, and then I want to ask you some of the things that Robert F. Kennedy Jr. added to what President Trump said was that acetaminophen, which is Tylenol, has been, associated with autism, and that pregnant mothers, and please correct anything that I'm getting wrong here, Katelyn, pregnant mothers, unless they absolutely need it. I thought it was weird, instead of saying talk to your doctor, President Trump was kind of dispensing medical advice, which I thought was grossly inappropriate, but basically saying, if it's really bad, you should take Tylenol, but, you should really try to just, what did he say? Gut it out, basically saying,
Tough it out.
Tough it out. All right. So let's just talk about this, Katelyn, as you watch this, and please, give us your expertise on what the White House is saying.
Yeah, I mean, I'm still trying to get my head around this, but I mean, I'll tell you, my first reaction was I could not even count the number of falsehoods that both Trump and RFK were saying. It was a fire hose of rumors, just not based in evidence. And it was a word salad, right? But what I was trying to, get behind is first, the biggest question, and this is how Trump started it, he said that this is the most alarming rise in public health history of any public health problem. And, there has been a rise in autism. I think the question is why? And we've seen that research has shown a lot of factors and what's contributing to the rise. One of it, the most dramatic causes of the rise, is just the way we diagnose. Autism has changed, right? We are better at testing it. We're better at diagnostic changes, where there's increased awareness around physicians and parents. And that's mainly why we're seeing a rise. Now, there may still, even when we account for diagnostic changes, there still may be a rise. And I do think it's really important to understand what is causing that. But it's not like this is anything new. I mean, scientists have been trying to unpack the causes of autism and the reasons behind it for decades. And what they have found is that, one, it's mainly genetic. There's a very strong genetic factor. In fact, about 85% of autism is from your genes. And then what they've also found is environmental exposures can act as triggers, right? Advanced parental age, premature births, maternal inflammation like high fevers, and other factors like obesity and air pollution. So I don't know. None of that was said during the presser today. And then they go on to say that they think it's Tylenol that is causing the rise in autism, as well as folate deficiency, and that there should be this new cure. And we can go into that a little.
Yeah, I want to ask you this leucovorin, which was part of the chemotherapy regimen my husband was on when he
Yep.
was being treated for colon cancer. It was 5-FU and leucovorin. So I'm very interested in that. But let's table that for a second, Katelyn, and talk first about the Tylenol. And so basically, were they saying that a pregnant woman should never take Tylenol, full stop? I just want to say what they said, and then we can kind of unpack it so
Yeah.
people who didn't watch the news conference know.
Yeah, basically said that women should not be taking Tylenol. Full stop. Um, which puts women in a very tough predicament because, especially during pregnancy, there's no other alternatives to Tylenol. But yes, that was very clear that they said that.
Did you understand any of the evidence that they had linking acetaminophen with autism rates? I know that President Trump said 1 in 12 boys today are diagnosed with autism. Some of the statistics he used seemed seemed I mean, you're the expert. Were they accurate?
I do not know where they got the 1 in 12 among boys. I will have to look. Usually with RFK, and it seems like Trump is following suit, there's usually a kernel of truth that is just mixed in a ton of falsehoods. What the latest numbers we have is, I'm trying to pull it up. I think it's 1 in 300 people or children in the United States have autism. But I don't know where that 1 in 12 came from, honestly. It was too fast to be fact checking in real time.
Yeah. So basically, they said, and what was your reaction to what was said? I mean, as you said earlier, if you all weren't joining us or weren't with us yet, Caitlin was saying there were so many falsehoods in this press conference. It was like a fire hose of falsehoods. What are some of the ones that stuck out to you, Caitlin, as you watched?
I mean, I think the biggest is that there's definitely this causal link between autism and Tylenol, and that's just not the case. the The reason why they're saying this is that the Trump and RFK's claims are really around this Harvard Mount Sinai study, and it was a review of 46 studies, but it. Even in that study, they did not find any really big link between the two. And the authors in that study flat out said they cannot determine causation, right? Correlation does not equal causation. And coming to that conclusion can be really quite dangerous. I think that it's very clear in 2024, we got this really nice study from Sweden, which looked at the link between Tylenol and autism. And what they found was that um, when they compared siblings, right, one exposed to Tylenol, one in utero, the other not, the link between Tylenol and autism completely went away. And that's because that they were able to control for other factors like genetics and family environment, which all of the other studies were not able to do. And so this 2024 study, in my mind, really put to rest this question whether Tylenol is causing autism. And that was never mentioned in this presser.
And did you hear anything that would convince you otherwise, that evidence did exist that did link the two things, that there was causation and not just correlation?
No, I mean, no, I have not seen a study that shows causation compared to correlation other than this Swedish study that refuted the link. And that nuance is really important in science, right? It's really hard to measure the real world in scientific studies. And so what we usually do is build on evidence, study after study, to understand what this picture is. And today, that picture doesn't seem to create a link. The other thing you asked me what was like the biggest falsehoods that like came to mind. The other really concerning thing, and you brought this up, was what Trump said is that like there's no downside in not taking Tylenol when you're pregnant. And that's just not the case. I mean, if you have a high fever and you're pregnant, that can cause autism, right? So like there's actually really big benefits to taking Tylenol and and protecting children in utero, that I think blaming mothers and women on this is really quite dangerous as well. So we can't just take the precautionary principle and say no one should have Tylenol.
Are there other painkillers or pain relief medications that are considered safer for women to take than Tylenol?
No, that's your only option. So they're basically taking away the only option that pregnant women have. And to me, as someone who carried 3 kids, that's just not acceptable too, especially when the science doesn't, it's not evidence based.
He also, I mean, Robert F. Kemp. Well, let's talk about the folate acid component of this too. They basically stated that a lack of folate or a lack of folate in a developing fetus's brain could also result in autism. I know that prenatal vitamins often include folate acid. I remember taking them myself when I was pregnant with my 2 daughters. But can you tell me about that claim, and if to use the generic name, okay, acetaminophen is the generic name, but can you tell me any claims or what your understanding is the role of folate, and if that could be somehow, as the administration is claiming, or lack thereof, responsible for autism?
I mean, it's very clear that folic acid or folate is super important during pregnancy, right? Large studies had shown folic acid as really important in preventing serious conditions like neural tube defects. There have been a few small studies that have explored whether this may shape development differently, but again, the evidence is just not consistent with autism in particular. I think that the case that RFK is trying to make, but I'll be honest, like it's really confusing because I'm having a hard time following their logic, is that if they're claiming that if you take Tylenol, it decreases the amount of folate and then what causes autism. And I'm having a really hard time following that scientifically because that's not how I'm following the evidence.
Let's talk about it. So, is folate the same as folinic acid or leucovorin, or is that a subset of folate? I'm sorry, I'm not a doctor, but I try hard.
Leucovorin is it's a subtype. It is not a supplement. It is a prescription, and like you mentioned, it's usually used in cancer treatment. There's this really rare condition called cerebral folate deficiency, and that's where folate in the blood looks normal, but the brain doesn't get enough folate. And there actually has been studies. They've been really small among children who are both autistic and have this condition. There are benefits to leucovorin in these very small trials. The challenge is, and benefits meaning improved communication as well as improved behavior, but much, much more research is needed. These are really small studies. We're talking about a very rare disease. And I think implying that anyone telling you to run out and buy this is grossly overestimating the evidence that we have right now.
And basically, I thought my understanding was what they were saying is they want doctors to start treating even children with autism with leucovorin. Did you kind of get that message from what they were saying?
That's the message I'm getting to is that they want to have everyone that may be at risk for autism or behavioral changes. I'm sorry, my 5-year-old is talking to me.
Oh, that's okay.
Here, okay, Ellie, I'll be back. Okay, in 5
Oh,
minutes.
is she Ellie too?
She is an Ellie.
I have an Ellie.
Okay. Yeah, I mean, and I think this really needs to be talked about, Katie, because there's conflicts of interest here too, right? So like if this is the cure for autism, let's follow the money and see actually who owns patents in this folic acid in folinic acid and in other supplements. And there are a number of wellness people out there that sell these supplements as well as provide a lot of prescriptions around this. And I I do, that has to be part of the story here.
Yeah, and the kind of they were really trashing science and trashing the NIH and basically saying they were looking at the wrong things. I think RFK Jr. was talking about how scientists have looked for the genetic reasons for autism and they should be looking at something else. And all I kept thinking when I was watching this, Caitlin, is, oh, great. Another reason to dismiss and disrespect and defund real scientists.
Yeah. I mean, that's the case that they're trying to build right now, is that this hasn't been evaluated. But we have so many studies of really brilliant scientific groups around the nation at Yale, at Harvard, that have been studying these links for a very long time. And to assume otherwise is I think very hot, like it's risky, and it's just not reflective of the reality on the ground. And one of the announcements today was that they're going to provide more funding into research. I think Jay Bhattacharya said $50 million extra, and that's great, right? But like that doesn't ignore that a lot of research has gone into this. It's a really challenging thing to study. In public health, a lot of health outcomes, if not all of them, are a combination of your environment and the genetics. And being able to tease those two apart is really hard. I think also here, a really important message is that Trump opened this presser saying that this is a horrible, horrible crisis. But I really want to hone in that autism is also not something that needs to be cured. It is a very natural part of human diversity. And people with autism deserve understanding, they deserve respect, they deserve inclusion, and they deserve the support they need and want. It is very unclear to me that and I would, very doubtful that the autism community is behind this and that this is what they think is needed for the future. And I think we really need to be listening to them to help drive research and where researches should be made.
That's a really good point. And what about the vaccine scheduling? He started talking about hepatitis B vaccine that should be given to kids when they're 12 years old. And he was talking about other vaccines. And I think we started talking before the moms who believe vaccines cause their children to have to develop autism. But can you tell us how you um, what you think about the statements made about vaccines at this press conference?
It was wild. But it's also, what RFK has been saying for the past 20 years. So I guess I'm not surprised either. There's a few things that they claimed. One is the number of vaccines. So Trump said, our kids get 80 plus vaccines, which is incorrect, by the way. That number is. They claimed that the MMR vaccine, which is a combination vaccine for measles, mumps, and rubella, should be separated. There's absolutely no evidence to show that the combination vaccine leads to more autism. They did bring up Hep B, which is very interesting given the ACIP meeting that was happening last week with Hep B, that it should be given at a later time or not given at all. So they
Well, what did you
definitely.
think of? I'm curious. What do you think of that Hep B recommendation that it should be given to a 12-year-old and it comes from being sexually active and that babies don't need to get it? Is what the president said.
Okay, so the most high risk that you can be for Hep B is the first 2, 3 years of life. Getting it at 12 years, you completely miss the risk window of hepatitis B infection and chronic disease. So, like, getting it at 12 years, like, that won't help. Like, I don't even know what
But
that.
what about his statement that it's from being sexually active?
So one high risk condition for getting Hep B is that the mom has a history of IV drugs or has multiple sexual partners. The challenge is, though, that's not all cases. In fact, only about 50% of cases are linked to that at birth, which means you lose 50% of other cases. And so it's really important, and this is why we have a universal Hep B vaccination at birth, is so it's a safety net. You catch all of the cases at birth. The vaccine is incredibly safe. There's very few risks to this vaccine, and the benefits outweigh the risks, basically. I will not be surprised if they take on Hep B next month at the vaccine policy meeting over at CDC. This has been a low-hanging fruit for them for a long time, and unfortunately will impact the most vulnerable, but also has impact on other children out there as well.
What else did you hear during this news conference, either from the president or from RFK Jr., that concerned you, Katelyn? Are you reading something?
I am. I'm trying to look at my notes. I'm like, what did I hear? I think that I don't. I think one of the most concerning things that I have is that we continue to blame moms, and give unfounded guilt around things that they do during pregnancy. And I think that is one of the most dangerous things that could come out of here. There's a lot of moms out there that feel a lot of guilt around their kids with autism. Some don't. But I think that taking away those tools and blaming it on something when they really want and deserve answers is not the right route.
So, what does this all mean? How does this get translated into public health policy, Caitlin?
Yeah, I was trying to keep that away from the word salads that they were saying. One is it sounds like they're wanting to do a safety label change on Tylenol, to talk about this risk, which will allow all uh, that will really sow more doubt into using Tylenol when you really need it and when it would prevent autism among pregnancy.
I want
The
you to repeat that. Sorry to interrupt, but I think it's so important that high fevers in pregnant women are precisely what has been shown to cause autism.
Yes, some studies have shown that a high fever during pregnancy can cause developmental challenges like autism. The second thing policy that I heard them saying was they want, which I didn't understand, they want providers to prescribe lower doses of Tylenol during pregnancy if they need it. Tylenol is not necessarily always prescribed though. So I didn't understand that policy change. And then the third I heard was an increase in research at the NIH towards autism, which okay, that's great. I'm all for giving more research, but I think that the underlying assumption was that it wasn't happening before, and that's just not the case.
And I guess what I thought was confusing, it sounded to me, and again, it was sort of hard to keep up with everything they were saying and to try to make sense of it, that there is something that can help with autism now, if and that is leucovorin, and that they were going to talk to doctors about using this more, is what I heard. Is that what you heard?
It's what I heard too. I really want to see this report that comes out to actually understand what their policy points were. It was really hard to parse it out of their word salad, like I said. But yeah, that is one thing. I will tell you, one of the worst things that could happen is also a run on the supply. We saw this with ivermectin, right? People need this medication for other things like cancer. And if there's a run on the supply because of a lot of worry and a lot of unfounded claims coming straight from the highest level of health, that's a really big problem, and certainly can be a ripple effect from this announcement.
He said the president said they pump so much stuff into those beautiful little babies. It's a disgrace. It looks like they're pumping into a horse. You have a little child and they pump in a blend of over 80 vaccines. You said earlier that is an incorrect number. How many vaccines do children get in general?
I knew you were gonna ask that, and I have the stats, but it is I mean, it depends on what you count as childhood vaccinations. I think by the age that you are 2, it's around 25, doses, right? Not different vaccines, these are different doses, as you age, I think by the time you're 18, it's around 60 if you include flu and COVID every year as well. But I want to be really clear, like, you cannot overwhelm your immune system with vaccines. Our immune system actually sees thousands and thousands and thousands of microbes and bacteria and viruses every single day. And our immune systems do a really good job at still protecting us. And so there's really no number of vaccines that are harmful at the schedule we see ourselves at right now.
They also talked about mercury, which my understanding is that has already been, is it thimerosal? What is that? What is it?
Thimerosal, yeah.
Thimerosal, sorry, that has been taken out of vaccines.
Yeah, yeah. I mean, that's what I'm saying. They're just like throwing in the whole kitchen sink with all of this. And I think that's part of the strategy, is a lot of confusion, a lot of chaos, hoping that some talking points stick and people take it and run. Thimerosal is actually a type of mercury. It's not the mercury that like poisons us over time. It's a different type of mercury. And yeah, it was only in about 4% of our flu vaccines. It's not in there anymore. Like that is not a concern right now in this moment.
So, but there are a lot of things in closing that are concerning to you with what we just watched happen. And I think it sowed a lot of confusion among the general public, among pregnant moms. What do you think pediatricians are going to do with this information?
You know, I don't know. I hope that pediatricians are looking to their professional organizations and looking to the autism community for their signals on what we should be doing in this moment. I think right now, pediatricians should also approach questions from a place of empathy. There's going to be a lot of questions from parents, there's going to be a lot of confusion. And in this moment, we cannot dismiss that confusion and call it disinformation. And we really need to meet people where they're at and take the time to answer questions right now. I think that's the best thing we can be doing.
And I would imagine the American Academy of Pediatrics, right? I mean, they're going to have a lot to say about this, will they not?
Oh, yeah. And they've been on top of it. I've been really impressed with AAP over the past, you know, forever, but especially the past couple months. They've really stepped up, made very clear guidance. And I would not be surprised if they have very clear talking points right now and going forward.
Yeah, I should reach out to them actually to see what they're telling. Obviously they're pediatricians, but also expectant mothers and just people everywhere, in terms of separating the wheat from the chaff when it comes to what's real and what's not real. We're living in such a bizarre time, aren't we?
It's exhausting. And I'll just say, like, as a mom too, I'm an expert in public health, and this is all confusing. Like, I couldn't imagine what all of my friends are going through, or my community, or fellow moms out there. And so I guess my biggest piece of advice, like mom to mom, is look to American Academy of Pediatrics, look to ACOG. They have a very clear, consistent, evidence-based approach, and I have not lost faith in them whatsoever. In fact, I think I have more faith in them in this moment. Unfortunately, we are getting to the point where we cannot trust our federal government at the same stature, and gaps need to be filled elsewhere. Yeah.
And then you don't have, a functional CDC, for example. So that's another place that you really can't necessarily trust for information and guidance. Of course, ACOG is the American College of Obstetricians and Gynecologists. Again, the American Academy of Pediatrics is another reliable source. And I'd like to add you to that list, Katelyn. And I'd love to stay in touch with you as this develops. I mean, we're talking right after this whole dump of information that was really hard to understand and really hard to validate. And so as more information becomes available and they potentially cite studies that they're claiming prove one thing or another, I'd love to continue to use you as a resource for everyone watching. And I want to make sure on Substack, you have a great Substack following. Maybe we can I don't know, is this both of our audiences? But I want people to come to you with questions about this. I know you'll answer them the full extent of your ability, but you'll also say what you don't know. And we really need reliable, accurate medical information in this current environment now more than ever, at a time that science is not only being trashed, but also defunded, which is one of my many pet peeves about what's going on in our country right now. Anyway, I have indigestion on that. It's so good Lord.
Yeah, well, thank you for having me. And my team is gonna go try to write down all of the falsehoods that was said, walk people through these studies, and the true implications that people may have. So hopefully there's an update from my newsletter here soon too.
Yeah,
But
so follow Katelyn, everybody, your local epidemiologist, which is one of the hardest words to say, but not as hard as epidemiological. So
you got
anyway,
okay.
thank you, Katelyn. I really appreciate it. Hope this was helpful, everyone.
All right.
Okay,
Bye.
bye. Bye.